hear from Pastor Emerson and the Rising Star Baptist Church. Again, Sister Emerson and I would like to wish all of you a Happy New Year. And so we're glad that you are on tonight in this special session that we're going to have. I just want to say that we have several churches that have been invited to participate with us tonight. Again, hello. Again, I'm asking if you would, wow, would you mute your phone? I'm trying to keep from master muting, but I will if I have to. We're asking that you would mute your phones to keep down the celebration in the background. We have several churches that have been invited to participate and be a part of our Zoom service for tonight with all of the questions and concerns and about the COVID and the vaccine that is now available. We've asked for some panelists to be a part of our program tonight to just speak to us, and they're going to do a presentation, and then we'll open up for questions. But before we do anything, I would like to ask if you all would just bow your heads for a moment. I'd like to give opening prayer. Now, Father, our God, we thank you for allowing us this day and allowing us this time and moment. We thank you, Lord, for bringing us together. Oh, Father, we ask, oh, Father, for clarity. We thank you for touching our speakers. They will speak unto our hearts and minds and help us to understand the pluses, the minuses, and ease their thoughts and their fears. We thank you, Lord, for allowing us to have this time. In the name of Jesus, we pray. Amen. Okay, again, I want to thank you again. This is normally the Rising Stars Bible Study Hour, but I chose to forego that tonight to bring a panel discussion to the church and community. We're seeking to get the information throughout the city, throughout our communities, to understand the vaccine. The reception or receiving the vaccine is lowest in our minority communities, and there are a lot of fears and concerns. And so we felt one of the best ways we could do that is we could come through our churches and participate. The churches that will have been invited to participate with us this evening is Mount Olive Baptist Church, Pastor Tim Glenn, Como First Baptist Church, Pastor Ken Jones, True Vine Baptist Church, Brother Jack Crane, Pastor Wendell Campbell and his church, and First St. John, Bishop Spears. They all have been invited to come on and participate in the panel discussion this evening. Also, I just want to also share with you and just lay a few ground rules that we're asking all you to respect. We've asked our panelists to each will speak approximately 15 minutes, and then from there we'll open it up for questions. Now, this is not a time to raise a question about you got bad service at the county, or you got not good service at JPS. That's for another day. That's another sermon. This is tonight information and to address your questions in reference to the vaccine and to maybe address your own particular fears or your excitement about receiving the vaccine. Let me introduce our speakers, and as the way I introduce them is in the order that they will go tonight. First of all, we will have Dr. Karen Duncan, and I'm going to read just one line background on them. Dr. Karen Duncan, who is the Chief Operating Officer, number 2 in command at John Peter Smith Hospital. Dr. Karen Duncan. Dr. Duncan comes to us by way of Atlanta, Georgia. She has literally been a part of turning the operation at JPS around. We're thankful for having her tonight. Also, we have Mr. Vinny Tejeda. Am I saying that right, Vinny?
Tanaja.
Tejeda?
Tanaja.
Tanaja. Okay,
Just remember, your cousin Vinny, okay?
Your cousin Vinny.
I'm sorry. Dr. Duncan is going to talk to us about the vaccine, and there are some concerns that, in reference to the Tuskegee situation that happened some years ago. She's going to talk about the safety of the vaccine. Then Vinny will also then talk to us about the rollout of the vaccine, the protocol, getting the shot, where to get the shot, how do we get the shot, and then I invited Brother Caesar Renti, who is Vice President of Pastoral Services for Methodist Hospital System, and I've asked him. He's going to talk to us about the experiences that he's as Vice President of Pastoral Services at Methodist. He will share with us some of the experiences that have taken place in that particular venue. Once they have finished each of their presentations, we ask that you would hold your questions until all three are finished, and then we'll open it up for questions. Okay? Now, again, this is not a time to say, well, they didn't put the cast on my leg right, or they didn't give me good service at the county. This is a time to talk about the vaccine and address questions and concerns about that. Amen? All right. All right. Okay. So let me introduce again Dr. Karen Duncan.
So, and thank you, Reverend Emerson. And I will come back and listen to your complaints about our service at JPS, because that's really, really important to me. So I will make a time in the future. But to Reverend Emerson's point, I think this is an important time in history with our COVID vaccine. I want to start off by saying that the skepticism, the mistrust that we have as African Americans is real. But we're also seeing that mistrust among even our healthcare workers that are not African American, and cousin Vinny can speak to this later. But we were a little bit surprised because everybody was waiting for this vaccine to come out. We even spent a lot of time deciding who was going to be first and second, and we were really surprised that even those nurses who every day care for patients who have COVID, who have watched the number of deaths that have gone on, have decided not to get the vaccine. And so understand that this is across the board, that people are a little bit skeptical about how this vaccine came out so quickly. We don't have a lot of long-term studies about it because we're all kind of learning as we go. And so I'm looking forward to coming back on a regular basis or being part of your newsletter to keep you updated, because we continue to all learn. But with that said, I do want to say that Reverend Emerson had mentioned to me that what he's hearing a lot from the African American community, from his congregation, is around this. This is the same thing as that Tuskegee Study. And so I want to talk a little bit about the Tuskegee Study, how that's a little bit different, and where we as African Americans and those who are part of communities and feel that it's important to get our vaccines out to our communities, how we need to look at this. I say that to say that the Tuskegee and the COVID-19 vaccine and what we've gone through are truly intertwined. Both speak to our distrust as African Americans of the healthcare system, and our reluctance as African Americans to go and seek medical treatment. We often find that many of us wait until the very last minute to go get treatment because we just don't trust the healthcare system. So they're very intertwined, and because of what happened at Tuskegee is why we continue to really not benefit from healthcare. Just to remind those about the Tuskegee Study, I think many of you probably know more about it than I do, but it was in 1932 that a number of African American men with syphilis were recruited into a study. And they were told that they were recruited so they could test a treatment. And in fact, they were not recruited in order to be treated. They were recruited in order to see whether African Americans progressed differently with syphilis than those who were not African Americans. And so they were misled. About 28 are recorded to have died during that study because they withheld treatment. There was penicillin at that time. About 28 are reported to have died, but in reality, that's probably underreported, and there was probably closer to 100 who actually died from that. What is even more tragic than that is of those who lived, they went home, they infected their wives, and those wives went on to have babies who had syphilis. And so what is a little different about the Tuskegee and what we have to keep in mind, I'm going to bring this back up at the end because I want to rally around this, is that treatment was withheld. Okay, so I, like you, I don't mistrust vaccines. We all get vaccines. Our grandkids get it. We get it. It really has been just transformational in healthcare. And as a pediatrician, just really seeing kids stay healthy, not get polio, not get whooping cough, all of those things that that I was exposed to. I'm kind of telling my age, in which I only got like a smallpox, but measles, mumps, and rubella, we all went through that. But now our kids just don't get that. So it's not that we mistrust vaccines. I wanted, to bring that up. And then on top of just kind of society and structural racism, we as African Americans truly do face a lot. I want to fast forward to where we're at today. We are really, unfortunately, in a high, at a time in which there is a highly contagious virus, COVID-19, and it's destroying our communities. I don't know about you. I have a 90-year-old mom in Ohio, and she turned 90 in 2020. I miss her. My sister takes care of her, but because I work in a healthcare system, I have not traveled there to see her. And so we've Zoomed much like we're doing here. But I want to see her, and I really do see that the vaccine is my way to be able to see her, and I want her to be vaccinated. So that's the reality. More importantly, as African Americans, we are disproportionately dying from COVID. We make up about 13% of the population in the United States, and yet about 21% of us actually die from COVID. So it is something that is truly tearing our communities up. And I don't know about you, but I really don't like to be alone. So I like to cause havoc for my family. And so I'm sure they're probably enjoying this time. I do want to put that out there, that our skepticism should be around the vaccine itself, and our questions should be around the vaccine itself. And the other thing I want to say is that unlike the Tuskegee study, the world is watching right now. We're watching everything that goes on. We know who's getting a part of the study, what's going on with it. We're all receiving the same information. So it's a little different than that. I would ask that all of us look at it, that what that Tuskegee study did is that it did not provide access of that penicillin for those men. And so what we need to do, more importantly, is to ensure that our communities have access to a vaccine. And we need to continue asking the questions about the vaccine. I ask questions about the vaccine. I can say to you honestly, even as a physician, as a pediatrician who gave vaccine, I was like, oh, I'm not going to be the first one. I really need to watch some people get it before I actually get it. But, that's the reality of all of us when something new like this comes out. But I think what we need to do as African Americans in our communities is ensure that that vaccine is going to be there in our communities for those who want to give it. As more of us learn more about the vaccine and we want to be able to receive it, we've got to have it available. Okay, and that was what the tragic part of the Tuskegee study was, is that they did not provide access for that penicillin. And so I want to encourage all of you. A little bit about the vaccine, and again, being a pediatrician, I know quite a bit about vaccines. This one's a little bit different. Most of the vaccines that we get have a little bit of the virus in it, whether it's live virus or whether it's dead virus that's in the vaccine that we receive. This one's a little different, which makes me feel a little better because I'm not getting like COVID particle into me. This has what's called a messenger RNA, and I'm going to be very simplistic about it. But if you remember those pictures of COVID, and it looks like all these spikes are coming off of a get that vaccine is it starts to get its marching orders, and it goes and it says at the muscle cells at the cellular level, it says, I need for you to make this protein so that when I get exposed to COVID, I'm already, you're not getting into my space at all, and so you're able to fight it. And so it works a little different than some of the other vaccines that we've had before. And there are basically two vaccines right now that we have. There's the Pfizer one, the one that you've heard a lot about, that requires the ultra cold storage, and then also the Moderna vaccine. And Vinny may speak a little bit about that. Both of them right now require two vaccines. I know there's some additional vaccines that are coming out, and there's even a question as to whether we need both vaccines at this time. The one vaccine is 21 days. Pfizer, it's 21 days later that you receive the second vaccine. And then Moderna is a little bit longer at 28 days. Most of what we're seeing as far as side effects, I believe Reverend Emerson got his because I believe he called to make sure he was on schedule to get it. But for most of it, it's just soreness around the arm area in which you receive it, and that sometimes is a little bit delayed. We are seeing a little bit more symptoms after the second vaccine. Vinny, again, I think you can speak better to this, but I think it's about 35% of people will have what feels kind of more like fever and chills. It usually lasts no more than 24 to 36 hours that you have it, and then it's gone away. I will say that a lot of the individuals that have been around me that have gotten their second doses, since I am at the hospital, I would say it's a smaller group that is having some of the more flu-like kind of symptoms, and the majority of them are saying, I'm fine with it. So I want to leave it there because I want to give you opportunity to ask questions. But again, I'm going to say that what was tragic about the Tuskegee study, and which we always need to keep in front of us, was that those individuals did not have access to penicillin. And so it's going to be important for us, as you learn more around the vaccine, that you ensure that our communities have access to that vaccine. And that's what I would challenge. Okay.
Thank you, Dr. Duncan. Okay, now I'll turn it over to Vinny, who's the Director of Public Health Department here in Fort Worth, Tarrant County, I'm sorry.
Thank you, Reverend Emerson, and thank you all for letting me be your cousin today. I've upgraded you to the VIP status. It is vaccine interested people, okay? Since you're here, you're wanting to learn about the vaccine, so you get a special treatment from me. I want to quickly talk about, where we are with the vaccine. And as Dr. Duncan laid out, this is very good news for our community. You know that we've been suffering through this pandemic for almost a year. In our county alone, 183,000 people have gotten the COVID-19 virus. 1,777 people have died. That's a huge number of people dying with just one illness in a short amount of, 10 months, 11 months. 130,000 people have recovered also, but that means there's currently 53,000 people ill today in our community. 1,453 of those are in the hospital. That is 31% of our hospital capacity, just one illness, right? Normally that doesn't happen, right? We have a variety of illnesses, cancer, heart disease, accidents, all kinds of things that are equally spread out. We don't let one illness take over like this, but it has happened. Our ICUs are getting full. 291 people are in the ICU in Karen County. That's more than half. 54% of ICU capacity is taken up. So this is very serious, and that's why we all need to get educated on how to get through this pandemic. So far, we've had what I call, avoidance measures. Wear a mask, avoid people, stay 6 feet away, avoid large gatherings, and then, don't go to things that are unnecessary. Only things that are absolutely important. Yes, you can go to meetings and other things, but try to do things online. Wash your hands throughout the day. We did not have any tool to fight off the virus. So now that the vaccines come out, we have a real opportunity here to get out of this pandemic and not let it damage our community anymore. But what that needs is a lot of people to sign up to take the vaccine. And not to belabor the point, but the vaccine is very, very effective. It's 95% effective when 2 doses are given. That is unheard of in the vaccine world. Only a couple of other vaccines come close. So if we all take it, the entire world takes it, we could get rid of COVID. But if we don't, then we will have to continue to deal with it every year, hopefully at a smaller scale like we do with the flu. But it's up to us, right? We all need to get educated, get comfortable about the vaccine, and take the vaccine so we can all get rid of COVID. So that's why it's so important that everybody participates. Another thing I wanted to highlight, as you know, African American community in our county has a high burden of chronic illness. At least 40 to 45% of the people have one underlying health condition, whether it's obesity, hypertension, heart disease, diabetes. You talk to anybody, you'll find people that have at least one underlying health condition. So automatically, these folks are qualified to receive the vaccine. They're in the priority group 1B. And we have opened it up, but the signups have been very slow. Only about 6% of our African American community has signed up. In the signups, not all of the African American community. Out of all our 300,000 people that have signed up, only 6% are African American. So it's a very low sign up rate, and this is where you guys come in to help us out, raise awareness about the vaccine, about its safety, why is it important to take it, so we can get the word out and get people signed up to receive the vaccine when it becomes available. Right now, things are in short supply, and we're going through in the order, we receive their registration, but we are working on plans to speed things up, get more sites open, get more vaccine in here, so we can start to do the work in our community. But the first step is to get the community educated, and that's where we need your help to get them educated, get them signed up, so we can start calling them when it's their number to get the vaccine. So I'll pause there, and I'll be happy to answer questions about the vaccine or any concerns or anything about our process to get the vaccination appointment.
Thank you, Vinny. Next, we'll have Reverend Caesar Rente from Vice President of Pastoral Services for Methodist Hospital.
Thank you, Reverend, and good evening, everybody. Well, I'm here to just talk about my experience. I've taken the vaccine, and I had the Pfizer vaccine. We had the vaccine here at Methodist Health System, and we had the Pfizer vaccine, and I've had both doses of those vaccines, and I'm here to report that all is well. I haven't grown a new eye, or I don't have any nanobots in me, and nor have I lost my spirit or my soul or love for God. Those are all the things that I've read on Facebook that would happen to you if you took the vaccine. And all I want to say to you is that my experience after taking the vaccine was as reported. I had some soreness around my shoulder, and after that, I was fine. I came to work the next day, put in actually some 2, 3 full days, and then the next week, I mean, it was just as busy as it was the week before. And so I've been pleased with my experience with the vaccine. The only time my heart raised was when I saw that needle. I mean, because I'm just that way about needles. But other than that, my experience has been good. But I would also say to this point that just like my colleagues, I was a bit suspicious. I carry the same history and lived and learned the same history of the Tuskegee experiment, and that I had those fears, and they were real for me, and I knew that I wanted to really deal with that, and I felt like the best way to deal with fear is to deal with it with truth. And so I started doing research, started talking to my colleagues, I started talking to the physicians that I know here that knew about the vaccine, and I really did my work on educating myself about what the vaccine was and what I would be doing. The other thing is I literally said, well, let me just consider my chances. What will happen to me if I get the coronavirus? I know it's going to impact me. I have type 2 diabetes. I know that I'm in one of those risk factors, and I know that it's going to impact me. So I know for sure that if I'm ever exposed to the coronavirus, not just exposed, but infected, it's going to impact me. I know that. But what I know about the vaccine is that it has a 95% effective rate, and that if I take it, I have a better chance against the virus. And so when I weighed it all out, I looked at the numbers. 20 million people have been infected. Over 300,000 have died from this virus. And it has impacted the African American community. I've worked at Methodist Health System for 25 years. I've been a frontline chaplain, and now I serve in a leadership position. I've seen the impact of this virus firsthand on the life of Black and brown people. While there are news reports and people see it every day on the news, I feel it every day because we're having conversations about how many bodies can we hold in our morgue. Those are the questions. Those are the questions that I'm having to deal with. The How can I get this person connected with their loved one because they can't see them? Using iPads, I had to order $20,000 worth of iPads for my staff so that we could get families in front of their loved ones so they could just see them on the ventilator, in the ICU unit, so they would be able to see them. So I see the real impact of this disease or this virus, and I know firsthand that it is hit Black and brown communities hard, and and we're no different than anyone else in the country. Here in Dallas, it's been the same way. And what I said was, when I took this vaccine, I didn't want to become a carrier. I didn't want to be the one that infected somebody else. I may have gotten it and may do fine and get through it, but the virus itself has it's for every for when you're infected, you can infect three other people. So it's like you basically can spread it without even knowing it. And to me, I didn't want to be that person to do that and make someone else sick. That was the first thing. The other thing is that I when I looked at my chances and looked at what's real and what's not real, well, the virus is real. All that other stuff that I read on the internet, that stuff is not real. I see it every day. I see the body bags. I mean, all the apparatuses and things that we are trying to do to take care of our families and take care of patients and do what we need to do to take care of folks. Those are the real conversations that I was having, and I said I wanted to do it to take care of myself. But I also know that it's important because I know that we all have the same suspicions, and I work with very smart people here in the hospital. I mean, and we all had the same thing. I will wait. I'm going to see what happens. But when I consider waiting, what we're saying is we're delaying the opportunity to stop the virus from spreading. If I'm taking the vaccine and I've now taken my second dose, and I think it's after 14 days now I have 95% immunity against the virus, and I'm counting my days. And that doesn't mean that I stop wearing my mask. It doesn't mean that I stop washing my hands or doing the social distance, because I do all of those things. But what it means is that I'm doing my part, and I think we all have to do our part. I took the shot. I videotaped the shot. I put it on my Facebook because I got family in Kansas City. I got family in Memphis. I got family in California, and they all had the same response. I'm gonna wait. I don't want to be infected or any of those things. And I shared it with them because I wanted them to see my experience. And I'm sharing with you, and I'm thankful that Reverend Emerson allowed me the opportunity to be here to share with you, because I see it firsthand. I mean, a couple 60 years married, this year his wife died of COVID. I don't know. I don't know how long they would have had their life together. But what I do know is that she prematurely died because she was infected with COVID, and 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 there was and he was not able to be here with her in her dying day because she's on a COVID unit. And to me, that's heartbreaking. We talk about the impact not only on the African American community, this is also having an impact on the medical community. Our nurses are working and they're working day and night on the COVID units. And I've said to, I've said to everyone that I've talked to that this is just like 9/11, the way it changed the airline industry. This is having the same impact on healthcare. Just as soldiers went to Iraq and they came back with post-traumatic stress disorder, post-traumatic stress and moral injury, and all of those different things that they struggled with, our nurses and our medical staff are experiencing the same thing. Those nurses that are on those COVID units are there with a doctor and physician, and sometimes they're the ones that are there taking care of the families. They're the ones that are there having to stop folks from having to come into the unit, doing all of those things just to take care of the patients. And what I know is that this is going to impact them in the long run. That's the other reason why I took it, is because I wanted to be good to my colleagues. I didn't want to end up as a patient in this hospital or in any hospital to impact them in that way. And I feel like we all have a role to play in this, and that that the science is good behind it. One of the things that I did was what I would encourage everyone to do is go to reputable sources and get your information from the CDC, the county website, the state website. Those are reputable sources. All these other sources, Facebook, that's not always true. So you can't rely on Facebook. What I'm sharing with you is to go to those reputable sources and trust, because there are a lot of eyes watching it. There are a lot of ethical eyes watching this science, and if something is wrong, if there's someone out to get us, it's going to be a huge big conspiracy that we will all know about. And I'm just saying it because I know that if we are going to stop this virus and get back to life as we once knew before we went to sheltering in place in March, then we're all going to have to take the vaccine. We're all going to have to do that. And I hope that you'll let faith and not fear be that thing that leads you, that you'll let this, education and all that be the thing that leads you. I had someone say to me, and I'll end, and Reverend Emerson, if you want to open it up for questions. I had someone say to me, well, I didn't have faith because I took the vaccine. And I said to them that faith and reason are not diametrically opposed to each other. That in fact, faith and reason work hand in hand. God has given us faith and God has given us reason. And I said to them, I said, you have faith and you have reason. I said, case in point, if I took you up onto the Empire State Building and started pushing you to the edge and said, just pray, ask God to help you, I'm going to push you off and your faith will save you. Reason to tell you that gravity is going to have an impact on your body. The virus is the same way. The virus will have an impact on your body. 20 million people have been infected and now have, and consider this, a pre-existing condition. There are young people today that have a pre-existing condition. 20 million people now have been infected by this virus. 300,000, over 300,000 have died from it. So we know the real impact of the virus. We know that the virus will infect our bodies. And what we have to do is make educated, sound decisions and choices about the vaccine. And we won't get immunity unless we're all doing our part to take it. And I'm doing my part to take it. And I've shared my story with my family and with my friends and with my church members and with everyone so that they will do the same. And I hope that you'll do the same. I mean, as elders and as as leaders and as members of your own of this congregation and of other congregations and influencers in your community be able to speak out about it and the the good that will come from it so that we can get this virus behind us.
Uh, Thank you, Reverend Rente. I want to share one thing also. I've asked Deidre. I know some of you put some questions in the chat, and I'm going to ask her to maybe respond or come forth and put that question out. One of the questions was to Vinny, if someone wants to sign up and register, where do they sign up and register for the vaccine? How do they do that?
That's a very good question. So currently we have a website set up, and it's www.tarrantcounty.com/COVID-shot. It's again tarrantcounty.com/COVID-shot. That's the best way to sign up. You fill out a form. Your information is recorded. You get an email saying it's confirmed that you are registered. It's just a registration. It's not that you're invited, because that's happening. People just sign up and show up. Don't do that, because there's a lot of people signed up, almost 200,000. After that, you might get a call the next day from a robocall system. Thank you for signing up. We got your information, and we will call you, email you, and text you with further information when your number is up. So that's how sort of the process works. And when your number does come up, you will get another email, another phone call, and a text message saying, show up tomorrow or day after tomorrow at this location. And, what we're asking is that people bring some form of ID. It doesn't have to be like a driver's license only. Anything that proves that you are who you say you are. Because stuff happens and we can't have, a medical, thing given to a person where you're not the right person. That's a concern. So we want to make sure we have some kind of proof. Any proof will do. Government ID, work ID, anything that is a foreign passport. If you're a foreign national, we're okay. We don't care what the status is. We'll just take any proof of that you're a person who you say you are. And if you have insurance, that's great. We'll bill the insurance. The government mandated insurance companies to pay for it, so there's no copay, no deductible. If we don't bill the insurance, the executives are going to enjoy millions of dollars of benefits at the end of the year while we paid our premiums. But if you don't have insurance, that's okay. There is no charge to anybody with or without insurance. There is no balance billing happening, nothing. It is free to the public, free to the recipient. So I wanted to be very clear, but you sign up at tarrantcounty.com/COVID-shot. If you have challenges in signing up, let's say you don't have a computer, can't get online to sign up, then you can call our hotline. The number is 817-248-6299. They will help you sign up. If there are people that have other languages that they need, we have some Spanish speakers and we have some Vietnamese speakers, but we also have the language line translation service that we will then call while we're on the call with you and help translate the questionnaire so we can get the answers filled in on your behalf, and the rest of the process follows the same. The only caveat is, the call centers are bogging down with all kinds of calls, so it may take a long time to get through. So just be patient. Otherwise, if you can find a way to get online and fill the form, that's pretty easy and instantaneous. So that's kind of how you sign up and how the process works.
So Vinny, can I add for those, excuse me, for those of this is Dr. Duncan, for those of you who are connected to a JPS medical home, we do have vaccine in our medical homes currently. It is the Moderna vaccine, and I can post that number or give it to Cheryl. But you would call the same number that you would call to make your appointment, and they will schedule you for your vaccine at one of the medical homes. The majority of our medical homes do have vaccine available to give. So I believe that number is 817-702-1100. It's the number that gets you into the call center at JPS. So again, if you are a patient at JPS, please call and let them know that you're a patient at one of the medical homes, and they will schedule you to receive that at that medical home. You will not have to come down to main campus. We are using our main campus for our employees, and so it's a little quicker if you have that vaccine at one of our medical homes. So that's also a point of access for you too.
Deidre Emerson.
I just wanted to repeat the COVID hotline number so that I can put that in the chat.
Yes, the COVID hotline number for the county is 817-248-6299. I think the option number is 7. That gets you right to the vaccine, folks. But I don't always remember those options because there's too many these days. So yes, you can call us and we will help you if you don't have access to a computer. But I will also tell you that almost 300,000 people have signed up. So you got to be patient with us. We are working on expanding capacity and expanding the vaccine availability. So it may be a little bit before we actually call you to get the vaccine. But you will get your confirmation pretty much the same day.
Okay, one of the first questions in the chat says, our behavior within the Black and brown community, it's like it's not real. How can you as an individual change the mindset?
Well, I think you have to. Well, I've always treated everyone's skepticism and their fear is real, and I respect that. I respect how people come to their decisions, and I think it's important to respect that there are some people that have concluded, based on certain things, that it's not real. I think the best way to deal with that is to deal with it with truth. And I think there are places where you can get a lot of this information that is public. I mean, the Tarrant County Medical Examiner can let you know how many people have died, and I guarantee you. I mean, I deal with it all the time with funeral homes, with all of these different institutions that have to manage the deceit and care of folks who have died from COVID. And I think what's important is to begin to look at, these are the number of people that are dying. I had a friend who said, well, this is like the flu. And I said to him, no, it's not like the flu. I appreciate you saying that. Yeah, you may have those same deals, but it's not like the flu in that what it does, and it's different than the flu. It's, you get a flu vaccine. This at the time we didn't have a vaccine, and people were getting sick and dying from it. And I as a person who works in the hospital, and I work with the families and staff, as I shared with them, I said, I just have to compare the data. I have to compare the data as to where we were this year as to compare to where we were last year. And we have a lot more deaths. And the only difference, is that there's COVID-19, and it is impacting our life, and it's impacting our communities. And I'm seeing more deaths than I've ever seen in my 25 years of working as a chaplain in a hospital. And I get the opportunity to see lots of births, and I get to see lots, and in our hospital, all of our chaplains are called to all of anyone that dies here. We're there with the family, and I've seen more of that this year than I've ever bared witness to. And so I would just encourage people to go and look at the data, to look at the information that's out there. And they're real stories. Every one of these stories, the 300 and plus thousand people that have died, those are individuals and families and lives that are real people. and they're not here with us. And that's just in North America. We're not even talking about the rest of the world.
And I would say that, you know, there are a number of people that believe this is real. I mean, many of us have had family members or ourselves been affected by it. And I think those are the ones that we need to target at this point. If we can get all of them immunized, then those who may never believe that this is real will also be protected because we'll have a significant number of the population immunized. And so in many ways, we will have protected them. So I really want all of us to focus on those who really, as we begin to get more and more information and confidence in the vaccine, that we make sure that we can get the vaccine for them.
Mm-hmm.
Thank you all. Since the vaccine is new, what kind of longer term side effects have been suffered by those who were a part of the group that was tested prior to the release, since it has been several months since they took the shot?
Benny, you could speak to that. We really don't have a lot of long-term data around that, but of those groups that were part of the studies, we aren't seeing any long-term, you know, effects from the vaccine itself. What we've got to be more concerned about is the long-term effects from getting COVID, because that we are seeing some long-term effects for those who actually have been infected with COVID, such as the COVID fog, where they don't have memory, such as chronic fatigue. So we're seeing more of those long-term, and probably even in children, as we start to see more and more children hospitalized for it, and they have growing bodies and brains that are developing, that's going to be the real concern for them as far as long-term development. Right now, and Vinny, I'll let you jump in, or Reverend, you know, I just don't think we have enough to really talk about long-term. That is probably going to be 10, 20 years from now that we'll start to understand it better.
Right. So the long term has to actually go by for us to be able to study what happens. But overall, it seems to be there are only short-lived side effects. The most common one being, you know, soreness at the site of the vaccine. Some people call it a swelling. You know, it's a little tight after the vaccine is given. Maybe 6 to 8 hours after you've got the vaccine, it gets a little warm and a little tight and just a mild pain. That's the most commonly reported side effect. Some people are getting a fever, you know, the same evening or the next day. That's actually your body responding well to the vaccine. It's raising the body's temperature to build that antibody that you need to fight off the virus. So that's very good news. You know, welcome news to get a fever. But otherwise, those are really just the common things. There are rare side effects. Some people just have a reaction to any injectable, right? They feel this faintness or feeling ill or nauseous. That is also being reported. We've had that even with the vaccine that we've given out. But the serious side effects that we know so far are allergic reactions. And what we're finding is that people who have had a history of allergic reactions to other vaccines or other injectable medications are at a higher risk of developing the same thing with these vaccines. So there are screening questions that we have on the consent form. It is discussed with your vaccine provider. And usually we have an ambulance on site, and we have an EpiPen. If you carry an EpiPen, we ask you to bring it along with you. You know, that way if anything happens, then you can take the EpiPen, and hopefully we can get you to a hospitals where, you know, they can take care of you, evaluate you. So far, knock on wood, nothing major has happened in our community, so we're okay. But those are the rare side effects that we've heard of happening all across the country in different settings. No long-term side effects are known at this point.
Yeah, and Benny, you know, that one of the requirements is, and it's really what kind of slows down the throughput, is that we do ask that you wait 15 minutes so that we can observe you for any reaction that you may have. But to Benny's point, we've given close to 9,000, because we've got an operation leader who is just amazing. But anyway, we've given over 9,000. We have not had any side effects, but we do continue to observe for 15 minutes.
And I want to share the numbers with us too. So for the county and its partners in the city of Arlington, you know, and the Northeast Tarrant County cities and Fort Worth, we've given around probably 32,000 vaccines as of today over the last 13 days. And we are sort of struggling with the total county data. The reporting goes to DSHS, and the information on their dashboard is lagging by multiple days because there's just a data deluge from all across the state. So it's taking a while to see what the clearer picture for the entire county is. But as you can see, JPS gave out 9,000. We've given out about 32,000. So at least between us partners here, we've given out 40,000 doses in a matter of just 12, 13 days. So it's pretty fast distribution. We're hampered by the supply.
And I would go to say too with side effects. We haven't. I mean, it's been the typical side effects I think folks have said here, but nothing major has happened to our staff or the folks that have taken the vaccine.
Deidre?
Yes, one of the callers asked, I'm allergic to penicillin. If I get the vaccine, what type of reaction should I be looking for?
I don't know that penicillin cross-reacts with the reagents that are in the vaccine. Again, that information would be collected at the time that you are receiving the vaccine. It should be put into the information sheet that you fill out and hand off. I would just say that most likely that person carries an EpiPen to take it with it, but there are a number of people who have penicillin allergies or other type of allergies. Again, carry your EpiPen, but there will be people there that will monitor you and also have EpiPens, but we have not seen that penicillin allergy is not on the list to exclude you from receiving the vaccine.
And there's a question, and Vinny answered part of it but I would want to ask, are any of the pharmacies, I know there's other businesses and pharmacies in the county that have vaccine. Some of them are issuing vaccinations, some of them are focusing on long-term care facilities, is that correct? In Karen County as well?
Yeah, and I see Vinny's picture went off. I don't know if he's still on, but to your point, they were given to some of the CVS's, or I'm not sure what's here in Texas, I apologize, but to some of the pharmacies, local pharmacies, but they were, from what I understand, Vinny, they were really directed to go out to some of these long-term care facilities and help immunize those individuals. So I don't know whether they've opened up to the public to come in and give it to the general public.
They have not. Okay. Yeah, so there was a federal program. So in Karen County, they've identified close to 300 long-term care facilities of different kinds, nursing home, assisted living, day activity centers. I didn't even know that they existed.
Yeah.
And then a few others that they just regulate through DSHS and Health and Human Services Commission. So there was a sign up, I think close to 200 plus got signed up through that federal program with CVS and Walgreens. The last I heard was on Monday from DSHS. They had already, they started immunizing on December 28th, and they've already given out about 6,000 doses for residents and about 1,800 for staff in 85 of those facilities. And so rest are yet pending. What is happening is there's actually active outbreaks in a variety of facilities, so they can't go in and immunize when you have an active outbreak. So they're having to wait for it to subside, schedule it, and then go and immunize. The other 100 or so facilities that could not make it to the federal list have the opportunity to sign up with DSHS to become a vaccine provider of their own, right? So they have nurses, they have medical directors, they can sign up, and then they can, get the vaccine directly from DSHS and immunize their own staff and residents. And if that doesn't work out, hopefully we'll be over this initial surge of mass vaccination, and then we'll try to get mobile units out and different things out to different facilities. It's just going to take a little bit of building all the pieces and getting it all going together.
Thank you. One of the questions says, after receiving the vaccine, what written proof is given to prove you have received it for the purpose of domestic and international travel?
Yes, so that's easy. There's a white card that is being given. It's a CDC card. We record the dose, what kind of vaccine you got, on what date, when is your next dose due. And when you get the second dose, the same card records it. So that's your proof. Whenever you travel, you can take it with you. If you lose it, sometimes that happens. Try not to lose it. But if you do lose it, there is a immunization registry at the state called InTrack2 where all of this information is recorded. You can get a printout. Normally you would get it from your provider or through the health department, but all our resources are going towards this mass vaccination effort. So that's why not lose the card, because you might wait for days before we can get you that printout, because everybody's so busy trying to get this vaccination out. So try not to lose that little card. It's a wallet size. Stick it in your wallet and just leave it there.
It looks like this, team.
Yes, that's right. Yep.
Al says, I'm familiar with the immediate side effects. I'm trying to get to the longer term side effects based on any available data, which is why essentially he's asking about the person is asking about those that were in a test group and if they've had any longer term of side effects since they took the initial vaccine.
Yeah, nothing's been published. Yeah, there's no real long-term side effect that has been shown to us at all, because not enough time has gone by to sort of figure out if there's a long-term side effect.
I'm sorry, DJ, but I might add to that also that I also sit on the prevalent study task force headed by UT Southwestern, and that information came out today that even though they've been in the study and they've gotten the shot, but they have not seen at this point any negative side effects, but it has not been out long enough to determine what, if any, what those side effects would be.
Well said, Reverend.
Dr. Fauci stated that if you have had COVID and have recovered, that you should wait 90 days until you get the vaccine. If you had COVID but never showed symptoms, the whole 2 weeks of isolation, should you still wait the 90 days?
Yeah, let me try to address that, because we get this question all day. So there is not a requirement that you must wait 90 days.
Right.
Once you recover from COVID, if you want the vaccine, we'll still give it to you. What is important to understand is that you have natural immunity that currently we understand is good for 90 days. It could be longer. Current data shows that at least 90 days you have natural immunity. So if you take the vaccine, you're taking it from somebody that could use it today, that is completely unprotected. Again, that's a decision you need to make. Do you want to take the vaccine? Sure. You don't need it today. You could wait up to 90 days. That's all is what he's saying. And then if you got COVID, it's usually about, current CDC guidance is about 10 days for recovery time. After that, you're eligible. If you have been exposed to COVID and you're being asked to quarantine at home, then wait the full quarantine period. I think it's now shortened to 10 days as well. After that, you will be eligible. And the reason is, normally when you're coming down ill with an illness, we don't give you a vaccine because your body's already fighting an illness. You don't want to fight it on two fronts, right? You don't want to fight the immunity that the generation of immunity by the vaccine and the attack of the virus. It's going to make your body get a little overwhelmed. So we wait. And then the other piece is we don't want you to come to a vaccine site when you're sick, because you're probably going to expose other people. So we wait till you're out of your quarantine and you're recovered from your illness, then you can get the vaccine.
Yeah, that's the biggest thing. We just don't want sick people coming into a place and infecting others. But to Vinny's point, it is a little bit harder to build immunity when you're sick. But if you happen to get it, you're going to be fine. The vaccine remains effective. So you won't have to go back and get it again.
I have a question. Is the mic on?
Yeah. What
are some symptoms that to look for that might let you know that you might be coming down with the virus that you might have? What are some common symptoms that you find?
Dr. Duncan, you want to cover that?
Yeah, so, it really varies. The worst ones, and the timing on it is very different, and we see different kind of people respond differently to COVID. A lot of it that people complain about is a lot of fatigue. They're really, really tired. They have really, really bad headaches that are difficult to get relief from even Tylenol. Those tend to be more behind the eyes that they get it. Also, a fever. They feel fever and they feel chills. Where COVID becomes very aggressive and ends up causing hospitalization is if you have the respiratory. So it's not unusual for individuals who who end up having COVID to start off by saying, I think it's my allergies. That's sometimes what you'll hear. I think it's my allergies, and they're out some congestion, it's runny nose, and then they start to get what's called the COVID cough with it. And that is what has to be really observed very closely. Now, we currently send a number of our patients home to be monitored at home. We give them what's called a pulse ox that measures their oxygen. We check in with them daily and ask them, and we get their readings to make sure that their oxygen is not becoming compromised, because it can happen very, very quickly. And so we want to watch it closely. But the hospitalizations, for the most part, is the respiratory part of it. But I will say that it varies. Probably a third of people just get the fever, chills, and the headaches, and then another third get more of the respiratory symptoms. With some of those progressing to more serious symptoms, little muscle ache, things of that sort. It's not unlike flu, and that it can be confusing during this time. So a lot of our rapid tests, or those tests in which we do test along with flu.
All right. Will the vaccine be a one-time injection with the 2 separate doses, or seasonal like the flu shot?
Vinny, I'm going to take a stab at this, but I'll let you get into it. So that still is somewhat debatable. What we're hoping is that the 2 will last, and I think there's been some literature that says that and I don't know which of the vaccines, but that it's probably about 2 years that it's going to last. So that'll give us time to get a lot of people immunized. I don't know if we have enough information to really say whether this is going to be more like the flu vaccine, in which we get it yearly, but it looks somewhat promising that this is going to have a longer immune time.
Yeah, so the studies that are coming out, they're showing that the vaccine immunity lasts between a year to 2 years. Again, these are projections. You have to actually let time go by to see what really happens. Currently, both Moderna and Pfizer are a 2-dose series. That is what is approved under the emergency use authorization from the FDA. That's what gets you the 95% immunity. What is causing some confusion is, in the UK, they made a policy decision. We need the vaccine out fast in as many people. So they're making a trade-off. They're letting the first dose go into every arm that is available. And that gives them a lower immunity rate of about 65 to 70%. So they're making a known trade-off that is not yet approved in the US. So we have to wait and see if the government or the FDA changes their guidance on how to do this. And the promising thing on the horizon is there is a third vaccine candidate with Johnson & Johnson that is a single-dose vaccine. It is not yet approved, but the current thought is that somewhere in March, April timeframe, it may get approved, and that will improve the supply, and that will also be a single shot that, we don't have to come back 21 or 28 days later to get a second shot. But all in all, currently, both are 2-dose vaccines that we have.
And I want to add to that it's important that you do bring that card back, and it's probably important that you go back to the same place, because they do have information around it. But if you get a Pfizer, your second dose will be Pfizer. If you get a Moderna, your second dose will be Moderna.
After we get the vaccine and make the decision to get the vaccine, will we still have to wear masks?
Definitely, yes.
Yes. So there's a lot of things that have to work together to get us out of the COVID pandemic. Masks are a source reduction strategy, right? Does it protect you when you're wearing it? Yes, to some extent. But what it really does is you may not even know that you're spitting out the virus as you're talking, coughing, all those type of things. And that's where, when you wear a mask, you're protecting everybody around you. And when enough people start wearing it, then the virus transmission really goes down. So when you get a vaccine, yes, it's going to help you boost your immunity and help you get protected. But we don't have enough data to know yet whether you will still be able to just get the virus and transmit. Normally that doesn't happen, but every virus is different. So currently the thought process is everybody should wear a mask till the majority of the people are immunized and the virus is at a low level in our community. That's when we can get rid of the masks.
Thank you. Because the government is pushing for vaccines, has the government waived liability for the company should bad side effects be discovered in the future?
I don't know, Dr. Duncan, did you ever read anything on that?
Yeah, I don't know with this vaccine. I will say that there is, for vaccines that we give in pediatrics, there is a certain portion of those monies that go into kind of a protection bucket of money, so that if there does come to be side effects and they get reported, that then, you know, that is the care of that child is taken care of. I have not heard that around this vaccine, but I will be glad to find that information. I think that's an excellent question to see whether it follows the same protocol as vaccines that we give for children or even for adults. Great question.
And how hard will it be to get the the appointment for the second dose?
At JPS, and I believe also with Vinny, on your card, you will actually get, in fact, they will go ahead and schedule your second dose for you, and that date is recorded on the other side. You should receive a text or a call or notification that you are due for your second vaccine. So we have some redundancy in the system, but you should receive that return appointment at the time that you come in for your first vaccine administration.
Yeah, and that's the same with us and most providers. So they'll write the due date of the second dose on your card, and then just in case you don't look at it or you lose it or whatever, our systems will automatically call you, because that's routine. For many vaccines, there are multi-dose series. For doctors' offices, your annual physical and everything, they're on a sort of an automatic schedule. So you will get an automated call, text message, email saying your second dose is due, come on back to this location. Now, typically you would go back to the same location, but since we're doing this all in a hurry at a mass vaccination setting, so we might have called you to the resource connection for the first dose. We might call you to a different location for the second dose, depending on which location has the staff and the vaccine available, because it's all very fluid right now. But the provider that gave you the vaccine will call you for your second dose. Don't miss it, because there's a 4-day window to get your second dose. And given that the vaccine demand is so high, if you miss that appointment, it's going to be hard for you to get in somewhere within the 4 days. Currently, we are getting allocations of the second dose, so we're starting on our effort to get that second dose into arms. So currently, the vaccine supply is good on that. There's no concerns, because the federal government held back half the doses of the second dose. So we're okay. Now, if there's a strategy change, like what UK did, that might change things, but it remains to be seen. So far, the plan is 2 doses.
Well, we're starting to see a number of different strains of COVID come out. How effective is the vaccine on any of the new strains that are coming out?
Yeah, so this is a routine thing with most viruses. Flu does this also. Most viruses do this. As they circulate, they mutate. COVID has already mutated many times. What started off in China, when it hit Italy and in Europe, it was mutated. It had a different look and feel to it. It was a different strain. What hit our East Coast was very similar to what hit Europe. What hit our West Coast was very different. So there was different strains already circulating. And now there have been 2 major mutations. One was in the UK and one was in South Africa. So they've done some testing against those strains. The UK strain, our vaccines are working really well against, so there's no concerns there, even though the UK strain is highly infectious, almost 1.5 times more easy to spread. So, the big surge that we're experiencing, we're thinking that the UK strain's already here. It's been found in Harris County. I can tell you it's everywhere. Just the surge that we're experiencing very fast. The South African strain, it's a little bit different. It is causing some concern that there's lower vaccine immunity against that, but they've been able to contain it very well in South Africa. So hopefully it doesn't spread out across the world. Again, it's a chess game, a lot of moving pieces against the virus, and we need to. That's why there's such a rapid rush to get vaccinated against COVID-19, because we just can't afford to have curveballs thrown at us right now.
So I heard you say about the time frame. You have a 4-day window to get that second dose. I mean, to respond to that appointment. But what happens if I miss my appointment? Do I start over if I'm outside the window? What happens?
So if you're within the 4 days, most of your providers are going to accommodate you. It's going to make things real difficult because people are going to have long lines and all those type of things. But we will do our best to accommodate you within your 4 days. After that, are we going to say no? No. I mean, you're probably still going to get the vaccine, but the immunity rate, the efficacy rate starts to go lower. And if you completely miss out on the second dose, it's okay. I mean, you still have that 65 to 70%, chance of being protected against the virus. You're not going to get the full efficacy of the vaccine, but you will still have some protection. It happens. Life happens. Don't stress out about it. But just remember that if you get a call to come get your second dose, try to do your best to get there and get that second dose.
Okay.
Pastor, that's all the questions that we have in the chat, and I haven't received any other direct ones. So
Yeah, let me say it's 8:21. Let me first thank Reverend Rente and also Vinny and Dr. Duncan for giving us your time this evening and the valuable information that you have supplied to us. The Lord laid on my heart, and then also the pastors that I named earlier, Reverend Jones and Reverend Campbell and Reverend Glenn and Reverend Parrish and Reverend Bishop Spears and Pastor Crane, we all got together, and the Lord just laid on my heart to pull this together. I mean, I've been just like you wanted it, but I think we got some great, valuable information this evening. We thank you for coming prepared to help us see. I want to share again. If there's a question you had and you didn't get it out, let me just say to each of you, if you email me or you can text me, Pastor Emerson, that we will get those questions to Dr. Duncan or to Vinny or to Reverend Renty and get responses back to you. So we will promise that we'll do that. One of the things I want to mention to Dr. Duncan, I noticed that when I went on the website of sites that you could get the vaccine, one concern we had was that Como was not on the list. And I don't know if they left it off or what. But
are you talking about Viola Pitts?
Yeah, I'm sorry, Viola Pitts, right?
Yeah. Okay. Actually, Viola Pitts opened up today, Reverend Emerson, so we may be a little bit delayed with it. But yeah, Dorothy had reached out to me. That was open and started today. So our sites start to receive vaccine. We have applied for all of our sites, including the jail, every single site to receive it. We just are waiting as the allocation is coming somewhat spotty. But Viola Pitts did open up today.
Okay, thank you. I want to say this to the entire group, all who are on tonight. Let me just share with you. The pastors came together and we agreed to lead. So all of us, the pastors that I've named several times, have all agreed. We have already gone and taken our first shot to include our spouses and some other persons connected to our families. I was reading a passage of scripture. Paul writes a letter to his son in the ministry, Timothy, and he says to Timothy, be thou an example of the believer and be that example in word and in spirit and in faith. And I felt as I lead the Rising Star Church, if I'm going to be an example of the believer, example of a leader, then I had to step out and demonstrate my faith in taking the vaccine. Now, as I said, I'll say to Como that I said to Rising Star, if I change and go to singing soprano from my bass, then you know there was a major after effect. But since I'm still a bass, I'm okay. We took the shot. I want to say to Dr. Duncan that some of the best service we received was at the Stop 6 Medical Home. They rushed us in, carried us in, gave us a shot. And I want to close and tell you this little story. I am a Vietnam vet. Going into the military, they gave you your entry shots. In those days, they did it by air guns. You stand in a line, and you got two medics on each side, and they're shooting you with air guns. It was not needles. But if you moved, that air gun would cut you, and you'd have to start all over again. Well, I've been paranoid about getting the shots ever since. Even when I'm in JPS and I'm getting the flu vaccine, I always say get some smelling salts because I'm going to faint. While we are at Stop 6 facility, yes, I'm nervous. I was nervous. Not about the effects of the shot, but just the touch of that needle. So, but I knew some of the nurses who were doing it. So what I did was, I was kidding with them and giving them a hard time. So finally, she started putting a Band-Aid on my shoulder. I said, hold on, what are you doing? I'm waiting for the shot. She said, Reverend Emerson, you got the shot, you need to leave. That's how smooth it was, and I didn't even feel the needle.
It is really true. You're right, Reverend Emerson. It is that you really don't. In fact, you wonder whether you got it or not.
Yeah.
I mean, everybody says that. Yeah. So.
Yes.
They sat us down. We sat there. They gave us a timer. We held onto the timer for 15 minutes. After that, the timer clicked off. We left, went home. And I just want to say to you, it was my faith, my trust in God. And then I had to consider, I'd much rather have something helping me combat it through God Almighty than me trying to do it on my own. And so I just want to encourage all of us. We're not trying to enforce anybody, but I would just want to say to you, I think the odds are greater to get it than the odds are not to get it. So I just ask every Christian on this Zoom, trust God through this process. I want to thank all of you again. Thank you, Vinny. Thank you, Karen. Thank you, Renty, for your participation. Thank you, all of the church members, Rising Star, all who are present tonight. We hope this has been a blessing to you and it's been pleasing to you tonight. Have a blessed night and a good evening. Amen.
Thank you, everyone. Thank you. Appreciate it.
Thank you.
Thank you all.
Bye.
Thank you. Appreciate it.
Thank
All
you.
right. You know, take care.
Thank you.
Thank you, Pastor
very much.
Keller.
Thank you.
Good night.
Thank you. Good night.
Is that Dr. Ernest Thomas?
No,
No, that's
that was
Antoine.
Campbell.
Dr. Ernest Thomas? Is that you?
No, that was Pastor Campbell.
Ernest Thomas?